Today's study that we're going to go over comes out of the Netherlands in September of 2020. Is the effects of hyperbaric oxygen treatment on late radiation tissue injury after breast cancer. So they looked at 67 patients in this case series. We'll kind of scroll through the abstract here and we'll get down to the conclusion where it says patients who underwent HBOT for LRTI, which is late radiation tissue injury, after breast cancer reported significant improvement in pain, fibrosis, edema, and shoulder movement. And this improvement persisted for up to 12 months after HBOT. So that was really the cutoff time for this study. They went 12 months following the conclusion of the study for their follow-up. Again, this study is available open access. You can just Google the title here or any of the researchers, and it should come up. So they used this lymphoma screening, I guess. There are typically 6 symptoms that they include. They only used 3 in this one. But basically, the patients noted at least one improvement in their scores on the lymphoma. Some of the things that we see with radiation injury are hypovascularity, where the radiated tissues, sort of the blood vessels get damaged, which results in hypoxia, and also there tends to be hypocellularity. So there's kind of a dysfunction in the radiated tissue. And obviously, with part of radiation therapy, the goal is to damage the DNA of the cancer cells so they can't reproduce normally. But oftentimes this has a similar effect on the healthy tissues that get irradiated. Here are some graphs. If you want to look at those, again, you can go back and take a look at it. But we'll get down to the discussion. I'm trying to make these quick for you guys. So one of the indications for hyperbaric oxygen therapy that's approved is late radiation injury or delayed radiation injury. This one, again, is on breast tissue and breast cancer patients. So the conclusion here, it says they found significant improvement in pain, fibrosis, edema, and shoulder movement scores among patients with LRTI after breast cancer who underwent HBOT. Shoulder movement was not followed up after completion of the HBOT. The improvement in pain, fibrosis, and edema persisted up to 12 months after HBOT, which again was the cutoff time for follow-up. So again, the very last sentence there is important. Clinicians should be aware of this treatment option for patients with late radiation tissue injury following breast cancer. Again, it's not just for breast cancer. Obviously, any kind of late radiation soft tissue injury or bony injury, like we might see in an osteoradionecrosis of the jaw, would also fall into that category. But again, this is the first of these studies that I'm going to go over. Obviously, breast cancer affects hundreds of thousands of women and their families every year, just in the United States alone. And so I thought this one would be a good one to start with. If you have any requests, any questions about particular diseases or conditions, please put them in the comments or reach out, and I'll be happy to do some research and go over them. I do read all of these studies on my own, usually once or twice over, before I take them out to any doctor's offices or clinic offices or whatever. But I just wanted to start sharing some of the information that is available on the use of hyperbaric oxygen therapy in different conditions. And as always, I will let you know if the condition that we are discussing is approved in the United States or not. Hope you guys learned something today. If you have any questions, please let me know.